It was a reason to celebrate, you know, can't wait for holiday, I can't wait for Christmas, I can't wait to go cinema. Like, it was just, everything was exciting. She was deeply caring.
I just thank you, Father, for making me me.
Chloe shouldn't have died. She shouldn't have died.
Instead, she should have had better care. That's what an inquest into the death of 13-year-old Chloe Longster has found. Chloe died from sepsis in 2022, 18 hours after being taken to Kettering General Hospital with cold-like symptoms and severe tummy pain.
The first time sepsis was mentioned was after Chloe had died. There were posters up in the hospital. I remember one of the many times I was stood at the nurses' station seeing this big sepsis board in the A&E. She needed rapid treatment.
Sepsis is a life-threatening condition that arises when the body's response to an infection injures its own tissues and organs. The immune system goes into overdrive, which can lead to multiple organ failures and death if not treated fast. Louise says she's still haunted by the trauma of watching this agony take hold of her daughter, pain for which medication was delayed.
It felt very much like Chloe was viewed as a melodramatic teenager that was, you know, just being dramatic. Chloe wasn't being dramatic, she was desperate. I have never seen her in so much pain. She asked me if they could knock her out. She asked me if she was going to die. That's how frightened she was. And I told them that, you know, to try and get them to understand that it felt like it just didn't work.
Chloe's family have waited 2 years for answers and for those 18 hours in the hospital to be scrutinised by a coroner. They believe Chloe, an otherwise healthy child, deserved better.
There was a clear lack of appreciation for her symptoms. There was a failure to follow the sepsis pathway that everyone is meant to follow. And that obviously meant that she wasn't treated appropriately and she deteriorated. And sadly for Chloe, that meant tragically that she died. The hope is that awareness will come out of it and that may prompt change so that no other families have to suffer what Louise, Chloe and their entire family has gone through.
Louise says she'll never get over how, in a room full of medical professionals, it was only her 13-year-old that was right about the severity of her situation.
Chloe had never needed to go to hospital prior to this. And I find that really hard, that she was brought up to be thankful that we have free healthcare, to respect our health workers. And in a time of real desperate need, when Chloe really needed them, they failed her so cruelly. And cruel is what it was.
Chloe suffered because of a catalogue of failings, say those she's left behind. Her family want a promise of change, of better care. It won't bring this smile back, but it could prevent the loss of others.
You believed you were getting the best care you could, but you weren't.
No.
You didn't know that. But you were advocating for your daughter,
yes,
as any parent would.
Yes.
But you were treated like a neurotic mother.
Yes.
This I've heard, many of us will have heard over and over again.
Mm-hmm.
And Chloe herself was spoken to by a nurse when she was in pain. And what was she told? She was told to calm down.
Yeah, she was, that was when Chloe was panting in A&E and the nurse came and sort of sternly told her that she was making her pain worse. She needed to breathe properly.
Well, almost that she was putting it on.
Mm-hmm. Yeah, that's how it felt. Yeah, that's how it felt, very much so.
She actually said to you, am I going to die?
Yeah, that was upon the paediatric unit and she wasn't in as much pain. But when she said that, I just remember thinking, she feels rubbish. She feels really rubbish. But did I think that she was going to die at that point? Absolutely not. No, I didn't.
You were Longster are living through. Their daughter Chloe's inquest earlier this month heard how staff at Kettering General missed multiple chances to diagnose and treat her for sepsis. The hospital has apologised to the family and says it is making changes. I've been speaking to Louise about their experience back in November of 2022 at KGH and her memories of her daughter.
Chloe, she was the greatest joy. She was such a lover of life. She loved animals. She was always excited for something that might be coming up. She was the embodiment of kindness. When we lost Chloe, the amount of tributes that we received from people that didn't know each other, that all said very similar, if not the same things, about how she was such energy and just a kind, gentle soul. She'd only had a mild cold, and that had developed into quite a nasty pain on the Monday. When we got to A&E, Chloe couldn't walk from the car to the waiting area, so she needed a wheelchair. And around 4 o'clock-ish, we were told that Chloe had quite a severe chest infection. The general sort of feeling in the A&E was that Chloe was being quite dramatic, and this was a child that, when she was asked her pain score, she said 9 out of 10. Now, Chloe was somebody that didn't like to bother anybody, so I knew she was in agony. And the nurse replied, "Really?" As if to say, you can't really be a 9. You know, it is terrifying, because you do feel, when it's your own child, of course, you do have an internal panic, even though you're trying to be calm. And, you know, and she'd never been admitted to hospital in her life because she was so healthy. So I knew something was really wrong. But you're met with, oh, there's other poorly children, there's a poorly baby, you know. And I just remember thinking, like, what is this, me? Am I getting this wrong? Like, what's going on?
And as it turns out, Chloe had pneumonia and sepsis. Yeah. It wasn't spotted. And as we've since heard at an inquest, the neglect and series of failures at Kettering General contributed to her death. And I'm struggling to kind of think about how that has made you feel.
It's really scary. So obviously we didn't get told the word sepsis until after Chloe had died. You know, when Chloe was heading towards critically ill, there was, by the sounds of it, there was still no real urgency to treat her. And I think what is really terrifying is, had Chloe went into the paediatric A&E, then to the Skylark ward, and then into intensive care, had any one of those units actually done what they should have done, as a basic level of care and following their own guidelines, Chloe probably would be alive. They had the equipment, they knew what was wrong, they had the test results. You know, there was plenty of staff. There were so many witnesses at the inquest, which speaks to how many people cared for Chloe at various points. And it was 18 hours that she was there. And I'm not sure what else was needed for them to have done the right thing.
And did you get any sense that medical staff realised that they'd made a mistake during her stay?
So Chloe died. We didn't have any indication, and Chloe passed away at 7:20 in the morning. Well, at 8 o'clock, I assumed it's shift change, because every single member of staff that was with Chloe left their shift. And it was like a mass exodus. And we were handed over to new staff to go and see Chloe. And it was the most surreal, bizarre. I mean, your head is gone anyway. But it's only when we've looked back, we've gone, that was crazy. Like, it was like, almost like we'd overstayed our welcome, you know, like we've done our best. We win some, we lose some, that kind of attitude. Like, it was really weird. And actually, we left the hospital. We were gone by probably 9 o'clock, maybe not even that. And we didn't hear from the hospital for 6 weeks.
What is shocking to me is that you're not the first parent I've spoken to who has lost a child at Kettering General, specifically at Skylark ward. There have been numerous reports, and obviously there's been investigations, and they've had inadequate ratings. It has since been upgraded to requires improvement. But you will have since found those things out, and I expect it I don't know how that must make you feel.
Yeah, we weren't aware that the CQC had done an unannounced inspection just after Chloe had died. We learned that in the March or the April of last year, when the report came out into the public. I'd believed up until that point, so 4 or 5 months, that Chloe died because she was a teenager and somehow less deserving of treatment, because I kept being told about poorly babies and poorly toddlers. But then obviously I saw that in the press and I saw the CQC report, and it's actually not because she was a teenager. It sounds like the care has been left wanting in many situations. Some of the same members of staff were involved in previous inquests, and you have to wonder what has to happen for there to be meaningful action and change.
Just so very sad. Louise Longster then, whose daughter Chloe, just 13 when she died at Kettering General Hospital. Yesterday, the hospital told us that they're sorry that we failed to offer Chloe the care she deserved. We should have done more, they said. They also say that in the 2 years since Chloe died, the way patients with sepsis are managed has improved, as have their staffing levels and communication with families. Louise Longster says she doesn't believe KGH has really changed, and she fears another family will go through what hers has. And we'll hear more from her a little later.